So I'm going to continue the story by the Gospel News, written by Fabio Giuseppe Carlos Corizio. It was written on the 26th of March 2021, and the headline reads, EU hard lockdowns are crimes against humanity. Italian magistrate complains to the Hague court, and that was the complaint was filed on the 24th of March. So I'm just going to continue where I left off on my previous videos. So Scandinavian countries do not trust in EMA. As early as April 2020, researchers at the Johns Hopkins Bloomberg School of Public Health predicted that more than 1 million children under 5 in low and middle-income countries would die in the next 6 months due to the disruption of health services. They also calculated a 39% increase in maternal deaths per month for the same reason. A new United Nations report has laid bare the appalling cost of lockdowns in some of the world's poorest countries. The report examines the effect of the unprecedented government shutdown policies on healthcare, social services, education and economy. It estimates that the disruption of the healthcare service caused by the government's response to COVID-19 in Afghanistan, Nepal, Bangladesh, India, Pakistan and Sri Lanka, home up to some 1.8 billion people, may have led to a 239,000 maternal and child deaths. This compares to around 186,000 deaths with COVID-19, meaning that the lockdowns are estimated to have killed considerably more than the virus. Psychic discomfort and drug abuse. As a direct consequence of forced isolation, there has been an increase in drug abuse. Deaths in the United States, a full-fledged drug epidemic within the COVID-19 epidemic. The same is happening in Europe. In fact, the European Institution of Addiction Treatment noticed an alarming increase in the consumption of antidepressants, alcohol and drugs. Pharmacies have increased their supply of antioxymolitics and hyponics by 35% and their supplies of antidepressants by 28.2%. We expect 300,000 new cases to be handled by mental health departments. Apathy, anxiety, depression, sleep disturbances, but also hyperactivity, a desire to violate restrictions and rebel against closures, to feel alive, are on the rise. The coronavirus epidemic is having dramatic consequences for the entire population, but those on physical health are limited directly to the infected. The psychological effects are not sparing anyone. Professor Massimo Di Giannatrio, president of the Italian Society of Psychiatry, has revealed in an interview with La Stampa. He has also pointed out we observe an increase in the sale of antidepressants and anxiolytics, a rise in psychiatric visits. In the second wave of the pandemic, the trend of an increase in drugs has also emerged last spring, is confirmed. According to the WHO, one of the main consequences of the emergency will be the multiplication of psychopathological problems and social distress. mRNA vaccines, cancer risk, WLO, crimes against humanity. According to Italian researchers, since the beginning of the lockdown in March, the endocrinology unit of Bambino Gesù Children's Hospital Rome has recorded a rapid increase of the outpatient consultation for suspected precocious or early puberty, due probably to the consequence of forced social isolation. Studies have established that early puberty may increase the risk of breast cancer. Stefano Vicari, head of child and adolescent neuropsychiatry on the above mentioned hospital, warned that from October to today, we have noticed a significant increase in access to the emergency room with psychiatric disorders. 90% of them are young people between 12 and 18 who have tried to take their own lives. I had all the beds occupied by suicide attempts for weeks, and it had never happened to me. In the emergency room, there is 1 hospitalisation per day for self-injurious activities. We are witnessing 2 phenomena. On one hand, we have adolescents who, in order to assert themselves, become aggressive, hurt others, hurt their parents, cut themselves, become interactable. On the other hand, we have young people who close up like hedgehogs, take refuge in the world, in their room, and we don't know if they will want to come out of their shell once the storm has passed. In parallel, the national referral statistic for eating disorder in England show a doubling in the numbers of urgent referrals during 2020, and CDC Director Robert Redfield remarked that there has been another cost that we've seen, particularly in high schools. We're seeing sadly far greater suicides now than we are deaths from COVID. Experts in Great Britain have called for urgent action to protect children and teens from harms of lockdown, saying youngsters are being used in an unethical mass experiment, added the complaint. The real dangers of SARS-CoV-2. We must point out that the health risks linked to the spread of SARS-CoV-2 is in itself too insignificant to justify such totalitarian measures. As a global level, the currently lethality of COVID-19 places this pandemic in the same category as previous pandemics, thus denying its alleged exponential character. According to Londis, many early deaths may have been due to the suboptimal management, malfunctional health system, sending COVID-19 patients to nursing homes, and non-somatic infections such as deaths are partially avoidable. Moving forward, global infection fatality rate is 0.515-0.20%, 0.03-0.4% in those 70 years. The complaint does nothing but propose a thesis already supported by the famous virologist Giampaolo last October, subsequently appointed president of the AIFA, Italian Medicines Agency, precisely because of his authority. The lethality of SARS-CoV-2 fluctuates between 0.3 and 0.6, while the SARS 2003 it was 10% and MERS 36%, 2 coronaviruses that became extinct within a year. This should reassure us a little. This infodemic, that is this information that has become pandemic, this fear of contagion, fear of death, this has become virulent and contagious. Common sense, reasonableness, critical ability to evaluate data from what they are has been lost. We are in the autumn of reason, Paolo declared on TV and to Gospel News. Italy, US academic virologist stop to pandemic. Terrorism, COVID-19 less lethal, lockdowns may destroy economy. A study published in the Canadian Medical Association journal found the risk of death from COVID-19 is 3.5% higher than from flu, but is considers only the first wave period, November to June, while it is reported that the fatality rate from COVID-19 has declined in all age groups during the second phase of the pandemic, according to Dr. Scott W. Atlas. 5 key facts are being ignored by those calling for continuing the near total lockdown, and one of these is COVID-19 IFR. The overwhelming majority of people do not have any significant risk of dying from COVID-19. The recent Stanford University antibody study now estimates that the fatality rate, if infected, is likely 0.1 to 0.2%. a risk far lower than previous World Health Organization estimates that were 20 to 30 times higher than the motivated isolation policies. In New York City, an epicenter of the pandemic, with more than 1/3 of all US deaths, the rate of death for people between 18 to 45-year-old is 0.1%, or 10 per 100,000 in a population. Or on the other hand, people aged 75 and over have a death rate 80 times that. For people under 18 years, the rate of death is 0 per 100,000. If you do not already have an underlying chronic condition, your chances of dying are small, regardless of age, and young adults and children in normal health have almost no risk or any serious illness from COVID-19. In this virus, we know that medical care is not even necessary for the vast majority of people who are infected, concluding Atlas. Pandemic and lockdowns based on fraudulent swabs. The entire lockdown architecture seems therefore to rest on two pillars: the number of positives identified by PCR and antigen tests and asymptomatic transmission of the virus. The studies we have produced to show that neither swabs can be considered reliable diagnosis tools, nor asymptomatic people transmit the virus or transmit it very rarely, as to have virtually no impact in the grand scheme. A massive COVID testing campaign is underway, not only in Italy but worldwide, costing countries billions of dollars. But more and more experts are claiming that the misuse of PCR testing is resulting in a vast number of false positives. It is the crude revelation contained in the statement of the World Organization for Life. Many are denouncing the testing as illogical and fraudulent, stating that it shouldn't be considered diagnostics. Yet these are the very tests that are used to report daily numbers around the country, justifying the policies to depress economy and society. The late Craig Mullins, inventor of the PCR test, explicitly stated in an interview that these tests should not be used for diagnosis purposes. On the 20th of January 2021, the World Health Organization issued an advisory for lab processing PCR tests, asserting that careful interpretation of weak positive results is needed. A positive PCR test does not automatically constitute a case of COVID-19, according to German attorney Rainer Fullemich. A number of highly respected scientists have concluded there have never been a coronavirus pandemic, but only a PCR pandemic. If someone tests positive, it does not mean they are infected with anything, based on the rules of the criminal law asserting false facts concerning the PCR results, or intentional misrepresentation that can only be asserted by fraud. Too bad that on 27th of February 2020, one of the most important research laboratories of the European Union and the world, Zebra Healthcare International, had joined the NGO One Nucleus to collaborate with certain drug companies that are producing vaccines. I won't name them because I don't want to get my video banned. Gospel News is unveiled in the report 23 report. It's a clear conflict of interest between those who have analysed the test and who can make money on the antidotes against COVID-19. As for the question of asymptomatic positives, the majority of people who have come in contact with the SARS-CoV-2 virus, we must say that the second phase of the pandemic has merged by starting from the assumption that the asymptomatic positives were contagious. OMV's accusations against points out how on June the 8th, epidemiologist Marie van Kerkhove, head of the WHO anti-COVID-19 technical team described asymptomatic transmission as very rare, although harshly criticised. This statement has been confirmed by several studies, among which we cite the one published on the 20th of November 2020 by journal Nature, which reports that results of screening from SARS-CoV-2 infection conducted in the post-lockdown in the city of Wuhan between May 14th and June the 1st, 2020, which was attended by over 9 billion people. Science agrees, over 9 million people. Science agrees that in general, although an asymptomatic person can transmit a microbe, which was attended by, I'm just going to read the figure here, which was I think it's nearly 9 million to 10 million people. Science agrees that in general, although an asymptomatic person can transmit a microbe, they do not transmit the disease. That is, people who are weakly positive cannot infect others because the viral load is too low to spread the virus. In the same report of an Italian CTS Scientific Technical Committee, it is stated that the identification of the viral RNA does not necessarily imply infectivity. In a study conducted in June of 133 researchers, the Mario Negro Institute of Pharmacological Research and 298 employees of Brembo, in which 40 positive cases were found, the positivity of these swabs emerged only with very high amplification cycles, including 34 to 38 cycles, which corresponds to the 35,000 to 38,000 copies of viral RNA. They are cases of positivity and a very low viral load, not contagious. We call them contagious, but they are only swabs. They only swab positive people. Stating from these assumptions, how is it possible to justify the imposition of quarantine and generalised lockdowns, asks the Sicilian magistrate, who however points out the contradictory attitude of the government, incorrect diagnosis and ignored therapies. The overall excess mortality recorded this year in Italy concerns mainly the month of March and April, first wave, and includes not only the death directly attributed to COVID-19, but also those resulting from the disruption of the healthcare system and from serious initial errors in the management of the emergency, the complaint reports. With regards to the last point, it is necessary to open a parenthesis referring for a more detailed analysis to the attached essay State Massacre. Although the Ministry of Health had already been informed in January, as evidenced by a note dated January 27th, that the mild form caused by the virus could progress to a severe form in people with already compromised clinical conditions and in the elderly. No precautionary measures to protect those categories of population had been taken at the beginning. Giugiaro recalls noting a contradiction made even more evident by the so-called cortisone scandal denounced by Gospel News. Cortisone defeats coronavirus, COVID-19. Oxford confirms Italian neurologist therapy neglected how many deaths for world who fault. In fact, it was neurologist Roberto Riccardi on the 24th of April 2020 who wrote to the Ministry of Health along with 33 other physicians to report the provincial use of cortisol drugs banned by the WHO and European governments in the previous March, and rehabilitation by the study of Oxford University only in June, but her letter about effective therapies went unanswered. Not only again in December, Minister Roberto Speranza, comforted by the technical consultants and AIFA, prescribed a simple treatment with paracetamol and watchful waiting, even refuting the efficiency of vitamin D. This remained valid until March, when the TAR and Lazio agreed, and the Home Care Committee, by freeing all general practitioners with the obligation to follow the national protocol. But let's go down to OBV statement. So there's plenty of reading on there for you, and I will leave the link.